Welcome to the Parkinson's Foundation, navigating Parkinson's and COVID-19 during the holiday season, where it's great to be here with you today. It is just, a terrific opportunity, and we're so grateful to the Parkinson's Foundation. We're also going to give away one of the books, Living with Parkinson's Disease, today, and we've had some great questions that have come in already, and I just want to say it's great to see everybody. I know that we've done a whole bunch of these Facebook Lives during the holidays, and it's been so great to be able to interface with everyone and to just make sure that we're thinking through all the things that we can do to stay safe and to make sure that we're enjoying our lives. And one thing that has become, very evident is that it is a little bit boring for people, a little isolating, and being off of our games, so to speak, meaning our different exercise programs, meaning all of the different things that we do to stay healthy. And we know that these things are important to staying healthy. We're a little bit off of our Parkinson game, and because of that, we're seeing a bunch of people, lots and lots of people across our Parkinson Centers of Excellence. We have over 40 all over the world, tell us that they're worsening during this pandemic. And so we do want to get together, continue to provide good information, but also advice on how to live to make sure that you can navigate through these difficult times. So thanks to the Parkinson's Foundation, I'm broadcasting here live. I'll be with you for an hour, and I come to you from the Norman Fixel Institute for Neurological Diseases and the Norman Fixel studios here at the University of Florida, where we just braved a hurricane turned tropical storm just a few hours ago. But the studio's on, and we are all ready to make sure that we are set to answer your questions. I want to just bring to your attention there are some great resources through the Parkinson's Foundation, and we have a 1-800 helpline with nurses. These are the best in class. You hear me brag about them all the time. I meet with them every month. We go over all the difficult questions, and they are really on top of it. This is the best team of nurses and health professionals to answer your questions free of charge. This is a hotline, and you pick up your phone and you dial 1-800, the number 4, and then the letters PD info, 1-800-4PD info. And if you're not old enough to remember this, the different numbers on your telephone actually have letters associated with them, and they can spell different things. And so that helpline with the best in class nurses to answer your questions is at 1-800-4PD info. If you'd like to get an aware and care kit, and this is for when you're traveling or you may end up in the hospital, this is something that can save you in the hospital. You can get that on our Parkinson.org. So we have www.parkinson.org. You can type in all one word, aware and care. That's the free kits. We've given out over 100,000 of these to save you heartache when you go in the hospital. Tells you everything you need to do, has rip-offs that you can give to your doctors, to your nurses, to your healthcare team. Super important. I also want to draw your attention that we have PD Health. This is a home online educational event. We have Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. And so there's something for everyone. These are awesome. They're also archived up on the website. And so you can go to parkinson.org/PD Health to access that. And then finally, staying up to date on the latest for Parkinson COVID-19, you can check our blog. So we put stuff up on the blog. And then also, if you've listened to my broadcast before, you know that we started a site with parkinson.org/coronavirus, all one word. Parkinson.org/coronavirus, all one word. And you can pick up all the previous editions of questions and answers. And so we're going to open things up here for an hour. We're going to have a great time. We're headed toward the holiday season, and we're just getting a ton of questions for folks that are interested in what's going to happen, as the holidays go. How can I have a holiday? Can I have a holiday? What can I do to stay safe? And so I just want to bring to your attention. This is what's called a Facebook Live. We love these events because we see people coming from all over the world. So tell us where you're from. You can type your question here. We're seeing traffic already coming through from multiple places in the U.S. I'm seeing the Netherlands light up here. We had a lot of Central America last time, some Europe and South America and Australia, and so we're going to watch here for all of your questions, and so bring those questions in. We're really looking forward to addressing as many of them as we can. So let me just start by saying that one thing that I am going to be redundant on this broadcast is that I believe when we head into the holidays, I want you to remember Dr. Okun's 3 C's. And if you know me, you know I like to have little quips and little ways to remember things. So the 3 C's for the holidays for Parkinson's disease: cover, control, and contain. Cover, control, contain. If you do those 3 things, you can have a great holiday and still visit with some of the people that you love. And so we'll get into the specifics here on that. But the first C is for cover. That's cover your face. Okay, so we need face coverings, 2 to 3 ply face coverings, none of these bandanas, none of these neck gaiter things, and no masks with one-way valves on them. The CDC says no to those. Okay, so a good face covering with 2 to 3 layers on that covering. You want to C. Second C is for control. Control your environment. Get outside. Outside is much better than inside, and contain. So if you can get outside during your event, that's great. And the last C is for contain. Containing the number of people in your events to 10 or less, and containing your eating. Get away from each other when you're eating, because that's when the masks come off. So you got to socially distance, but you got to get away from each other, maybe in the outdoor areas. People that don't live in your house every day shouldn't be sitting with you while you eat. And so there is a way to get together. It's 3 C's, Dr. Okun's 3 C's. C, cover. Cover your face. C, control environment. C, contain. Cover, control, contain. We'll come back to that. I'm going to be redundant. Those are the things that I want to stress because I want to make sure that you enjoy this holiday season, but you stay safe because coronavirus now is peaking like we've never seen it before. We knew there was going to be a peak here in the winter months, and we're seeing it. And not only are we seeing it here where I live in Florida and in America, we're seeing this all over the world. I had a call yesterday with Germany, one with the Netherlands. We're all seeing it now, and so we've got to work together and do what we can to contain things and to keep you healthy. Now, this whole podcast and this whole Facebook Live, we're all about answering your questions here. We're focused mostly on the things that are going to keep you healthy, so you can enjoy the events of the holidays that are coming up, Thanksgiving and Christmas. But we'll also take questions on anything that you have and that you want to ask. And the reason for that is that we know you're isolated, and we know that you need us to reach out and help with things. So the first question that someone wrote in to us asks, what advice do you have for those living with chronic conditions like Parkinson's disease when it comes to celebrating the holidays this year amid the pandemic? So we talked about the 3 C's: cover, control the environment, contain people, and contain your eating arrangements. The 3 C's, obviously. Second is that we don't have data that suggests that you're at any increased risk to acquire COVID-19 infection because you have Parkinson's. Now, it could turn out after the pandemic's over, we get some data that shows that there's an increased risk or a slight increased risk. But right now, we don't have any data to suggest that's the issue. What we do have data on is people with chronic diseases like Parkinson and diabetes and other diseases are having a hard time shaking COVID, and sometimes COVID can take your life with these diseases. And so because Parkinson is in that chronic degenerative disease category, it's very important that you treat this with gravity, with seriousness, and that the people around you, even if they want to be, less, let's say, stringent on requirements, that you remind them that they're doing this for you, okay, if you live in that house or you're visiting with people during the holidays. And so if you get together, C, cover your face, first C. Second C, control your environment, go outside. Third C, contain people. 10 people or less at gatherings, and and contain your eating arrangements. If the mask comes off, you need to spread out, eat, and then put that mask back on. If you do these things, we believe that you can stay safe. So thanks for the first question that was sent in prior to this. We have a number of people now that are logging in. I want you to ask your questions online. I see Nikita Krulart from the Netherlands greeting us as a representative from the young onset Parkinson disease community. Nikita, it's great to see you, and great to see you back. It's great to have you. I see Hana Tabara is writing in and asks a question about, should a patient with Parkinson's disease have the flu injection? Hana, I'm going to tell you something really important, okay? COVID-19 or not, you should always get a flu shot if you have Parkinson, okay? And there are sort of two varieties of flu shots, and one that's a stronger shot than the other. And we want you to get as strong of a shot as you can get so that you'll get as much protection as you can. We are seeing folks now that can get both COVID-19 and flu together, and that, of course, would be a potentially deadly combination in Parkinson. Now that people are congregating indoors and flu is going up, this is a potential disaster waiting to happen. So even before this, Hana, I told all of the persons with Parkinson that I care for that you must get a flu shot. It's super important. I also tell people I try to stay nonpartisan. I'm an independent. I'm here to just give you the best information I can give you as a cabinet advisor. And so, forget about views on science, views on whether you think people should mask or not. When it comes to the folks that I see in my clinic, when I walk into that room, I tell them, look, my mask is on. I got my mask right here, okay? And you should have masks, and the people around you, if you're a person with Parkinson, should have masks. We believe it strongly, and we don't want to get into the politics. We believe that there's good science to support it. We just want to keep you safe, but you can vote for whoever you want, or have whatever views that you want to have. And second, you should get a flu shot, okay? Even if you have suspicion about vaccines or whatever your views are, the science would say once you have Parkinson's disease, the cards are stacked against you. Now, in the COVID pandemic, if you get flu and you get COVID together, this is going to be a potentially deadly combination. So great question. Get your flu shots for sure. So thanks, Hana, for sending in that question. It's great. I see Raj Chowdhury is in and has some nice links that he's got up here for folks, and people are watching and thinking about holidays and holiday streams and how to deal with the different holiday streams. So thanks. And Aaron Rebecca asks, do patients who have had the DBS surgery have more risk to get COVID-19? So Aaron, thank you for that question. We do not believe that the risk actually increases if you have DBS surgery to acquire the virus. Now, we believe that only based on the limited data that we have in the middle of an ongoing pandemic. So let me just say we could be wrong. And one of the things that I often say to our students and to our residents and to our fellows that are training is it's a very humbling experience being a doctor and working with great healthcare professionals, and I feel like I know less every day. So I don't want to give you an answer that's wrong, but right now we do believe, to the best of our knowledge and the best of the scientific data, that having deep brain stimulation surgery is not going to put you at risk to get coronavirus in the future. The other thing that you didn't ask that gets asked quite a bit, at least of me, because we do quite a bit of deep brain stimulation at the University of Florida. It's a center that under the leadership of Kelly Foote with that program just sees people from all over the world. And so we get this question, is it safe for me to come in for my battery changes? Is it safe for me during COVID to come in and get surgeries? Well, guess what, Aaron? It turns out one of the safest places, if not the safest place, is actually the hospital during a COVID outbreak. And we're learning that because of the restrictions we put on visitors, to the strict masking policies, both of the folks that are taking care, if they have adequate PPE. So if the hospital is stacked with adequate PPE, or protective equipment, then you're in great shape. And we're actually not seeing outbreaks among the folks that we take care of, or outbreaks among people that are within our system. And I'll give you an example. We had a nurse that I know who sits in a group with a bunch of nurses, and she picked up COVID-19, and she was sitting there probably for several days, very close proximity to the other nurses, masked, washing her hands, distanced, okay? And she didn't pass it to anybody once it was discovered that she had COVID-19 with very few symptoms, and recovered, did not pass it to any of the patients or to any of the persons with diseases or to the family members. And so it's super important. So you can have your battery changes, and you can have your surgical operations. Now, once the hospital reaches a maximum number of people that are in COVID wards, so we have a COVID ward. So this is mind-blowing, like 1918 during the pandemic. We have wards of people with a singular infectious disease. Once we have a certain number of people in those wards, the hospital system gets stressed. And so in the system that I'm in, we've seen it go up and down. That magic number seems to be about 80 to 100 people. And so at that point, we may back off on the elective surgeries that we're doing, because we're not going to be able to handle taking care of those people, making sure we have all the resources and all the ventilators and things that we need to take care of those people. So as long as the numbers stay reasonable and you're not at a breaking point, those are the discussions that you want to have with your individual provider. So thanks, Aaron. Now, I want to pause here and say that Kathy Whitlock at the Parkinson's Foundation did a great job putting this together, and we have a giveaway for a free autographed book from Living with Parkinson's Disease. It's one of the new books that's out here by myself, Irene Malati, and Wissam Deeb. It was put together by the Robert Rose Company. They're famous for doing cookbooks, and the reason that we worked with them is that they're great at putting information together for persons with Parkinson's. In fact, a lot of the tables that are included in here are foundation tables. We've worked with the Parkinson Foundation. I've been the medical director since 2006. We put a lot of our secrets into the book. And so our winner today is Sherry. And Sherry was asking us a question about her second and third toes on her left foot starting to curl. And why are they doing that, and how can I stop it? And so it turns out, Sherry, we're going to send you a free autographed copy of this book. And in this book, you'll see every chapter has a picture of a person with Parkinson, okay, so, and their story. And so that this is a disease about people. And there's a whole chapter on medications and botulinum toxin. But let me give you the bottom line, so you actually don't have to wait to get this in the mail. The bottom line is that you can treat this toe curling very simply. It's usually an episodic thing that happens as the dopamine levels get lower as medications wear off. It can often be treated by changing the intervals of how you give dopaminergic medications, moving those intervals a little bit closer. And in some cases where you can't quite get it, you can actually inject something called botulinum toxin. So not just for wrinkles, you can do it for dystonia. We were using it for dystonia and other disorders before we were doing it for wrinkles. And so thank you for the question, Sherry. You're the winner of this book, and we will mail you an autographed copy of the book. And thanks for your question, and thanks for everyone else who also sent in a great list of questions. And sorry we couldn't give winners to everyone. So thank you. So Erin wants to tell us, she's from Chicago. So thanks, Erin. Erin asked our previous question about DBS surgery and COVID-19, and so I think that's super important. Let's move now to Sandy Roof. I hope I'm pronouncing that right, who writes in telling us a little bit about the protein connection with carbidopa, levodopa, or these dopaminergic medications like Sinemet, or maybe you live in Europe. I'm seeing some Europeans on already here, so you could be using Matapar or Cinemed or carbidopa-levodopa or Rotari or any of these dopamine replacement types of therapies, even Mucuna. What about if you eat too much protein? What's going to happen? Is that going to disrupt your ability to be able to absorb the medication and to get a great response? Well, the next great frontier, and you heard it here first, of research is what we call the gut-brain area of research. We are really engaged in this search to understand the links between brain disorders, the gut microbiome, and all sorts of things that can affect everything from risk to get a disease, or, as Sandy wants to know, tell us about if you have a disease and you're eating a certain diet, is it keeping your medication from absorbing? And so there is a known interaction between proteins and how we transport these proteins and the medication in the gut. There are these little transporters on sort of the edge of what we call the epithelial layer of where we absorb things in the gut. These can be affected in Parkinson. Now, there's one study out of Columbia University that quotes a number around 10%. So we think based on that study, maybe 1 in 10 people have this. There's a lot of argument, and this study needs to be done better. And I believe it will be done better by multiple groups over the next 5 years, or at least maybe not done better, but we'll have more information so we understand who has to undertake protein restriction. In my experience, most people do not. And at least in my experience, most people can get away without protein restricting early on in the course of the Parkinson. But as things move along, if they're taking medicines very frequently or having these so-called up and down motor fluctuations or dyskinesias, some minority, not everyone, some minority will need to decrease the amount of protein they have in their diet, or eat smaller meals, like maybe 6 small meals instead of 3 large meals, or eat whatever you want and wait a half an hour to an hour before you eat. So in other words, you take the medicines, you give the medicine a head start so it gets to absorb and use all those transporters in your gut first. So the rule is give the medicines a head start, Sandy, and then wait an hour and then take the food, and that way you can avoid the interaction and keep your diet the same. There is a reality that there's a garden or a cottage industry, as we like to say, and no pun intended, that sells books about diet and Parkinson, and we have more people giving more amounts of advice without data than we would like at this point. So we'd like to get more data. I see this as the next big horizon to understand this, but it's a minority of folks. And Sandy, here's the bottom line. If you find that you can eat protein and it doesn't affect your carbidopa-levodopa, affect your off times or on-off, enjoy your life. Don't worry about it. If you do find that it's affecting things, give your meds a head start. Okay, half an hour before, give your meds a head start. Okay, Sandy? And then if that doesn't work, then you might want to start to protein restrict. But work with your entire healthcare team. It's great to have a nutritionist or a dietitian on board. We have 2 here at the Fixel, and I just love them. I mean, they're just absolutely tremendous, Carly Rausch and Matt Beck. And so it's great and fantastic to hear this question. So I think it's a great question. So let me move here to one of the questions that was sent in before, and it's a question about COVID-19, and it's about the holidays. And this person wants to know, what unique considerations should those living with Parkinson's disease and their families keep in mind to safely celebrate the holidays? What unique considerations should those living with Parkinson's and their families keep in mind to celebrate the holidays? Well, I promised you redundancy, so here we go again. Okun's rules, the 3 C's to enjoy your holidays with Parkinson: cover, control, contain. Cover your face. 2 plies at least, if not 3, okay, layers. If you're not using a surgical mask, then you want 3 layers, okay? You don't need an N95 mask. We know that from the CDC. Those need to be fitted to your face. If you can get it fitted to your face, fine. Those are great masks to have. We do want to reserve those for people that need them in the hospital, so don't buy them all up. But a regular 2 to 3 ply mask is great. None of these bandanas, none of these gaiters, these neck gaiters that you pull up, these are not good. So stick to just regular 2 to 3 ply masks. That's the C, that's for cover. Control your environment, get outside. People who are inside and congregating are getting more COVID spread between, so stay outside during your events. And the last C is contain. Contain your people to 10 or less at a time, and contain during eating. Spread out when you eat if the mask comes down, and then as soon as you're done eating, put the mask back up. Cover, control, contain. Those are the unique considerations, and we should all do this out of respect for those persons who have Parkinson's and other chronic disorders, diabetes, or other people who are immunosuppressed or on medications. We should do this for the elderly. We should do this in anybody who's at high risk. We should do this anyway, okay? But I want to make sure that we put the message out: cover, control, and contain. The 3 C's. That's the way to get through the holidays and still have a chance to see, the people that you love. So Tracy Montoya says, I'm canceling until next year. That's what I'm doing for the holidays. And Tracy, that is a good conservative thing to do. And I would also say that, remember, I'm talking about people who have the ability to get to relatives' houses, who live within a reasonable driving radius, but some of you need to get on airplanes, and getting on airplanes can add another layer of risk. And so, Tracy, I'm with you. I understand. And if you want to be conservative, just wait it out until next year. That's certainly a very conservative way to make sure that you're not going to come down with corona. Sharon Young, greetings from Montana. Fantastic. Great to have you on, Sharon. It's fantastic. I know that we've talked to a number of our fellows that we're training. We don't train enough about sending people up to Montana because you have a shortage of Parkinson's disease specialists, but it's great to see you. We'll try to keep your information as up to date as we can. So, though Tracy is staying home, she does want to know, does cold weather make the symptoms worse or exacerbated? So let's take this question apart, Tracy. So the cold weather, so stress, anxiety, and sleep deprivation, any stress on the symptom with the type of circuitry that's involved in Parkinson, any stress on the brain can make the Parkinson's worse. So cold weather where you're not wrapped up can make things worse. And also when you're wrapped up, I don't know if you all have experienced this before, but when you're wrapped up and you have a mask on, it's actually hard to see your feet, okay? This is something we're very concerned with Parkinson. And so make sure you have an arm around somebody that has Parkinson. Make sure they're not going to fall, because, even the mask itself, depending on how big that mask is, can make it hard to interact with the environment. It's one more thing for them to worry about. So put your arm around them and make sure that they're not going to fall. The cold weather, particularly at certain temperatures, can actually make Parkinson's disease symptoms worse. I don't know about COVID-19. I would guess that in certain cases, yes, in certain cases, no. Some people like cold, some people like hot. Also, with the temperature going up in the body with COVID, some people may want to be cooled a little bit with it. So it's a tricky area. Now, one thing I will say, Tracy, is remember, if you have someone with Parkinson, a person with Parkinson that you're around, when it turns cold, whether there's a pandemic or not, curbs can be difficult, particularly if there's a mask on, but even without a mask, curbs can be difficult in walking through city streets and uneven surfaces. And when it gets cold, the streets get slippery and they may fall even more. So again, put your arm around people, protect them, keep them from having a neck fracture or a fracture of their arm or breaking their back or any of the things that can happen when we slip on pavement. And so I think that's super important. So Tracy, thank you, and certainly appreciate the question that you've got. So I have another question from Tracy Motz, who has both type 1 diabetes and Parkinson's disease. So Tracy, thank you for your question. We have actually looked at type 1 and young people with type 1 diabetes. There's a couple of studies in the literature, and guess what, Tracy? It seems to be that if you put a bet down in Las Vegas or wherever, if you're in Monte Carlo or wherever you're gonna place your bet, it seems that folks who have type 1 diabetes are at a higher risk to get Parkinson. We don't know why, but there's a slightly increased risk, and we've seen this now published, and we're looking for some replication, which means we want to see this in other studies. Now, for you, Tracy Motz, we want you to be really doubly careful because you have two things that could make it difficult for you to recover from corona. You have both the Parkinson and diabetes is one of those chronic diseases that we worry about a lot, okay? Not just a little, but we worry about it a lot. And so, if you're thinking about holiday gatherings, you've got to be really careful. Now, some people will actually double mask, put a second mask, one mask over the second mask, and make sure it's tight up against, the cheeks. And when you put a mask on, and I'm probably, speaking to some experts here, and everybody knows this now with the pandemic, can't be around can't be a mask beard. It's got to go down underneath the chin. Can't be loose. I see all these loose masks that are falling off and can't have extra space so air can get in, from the outside. And so, Tracy, it's going to be super important for you to have that C for cover, especially with the two things that you have. And you might be one of those people that we would say, everybody else, you don't need an N95 mask. But if you got an N95 mask, Tracy, you'd need to get somebody to fit the right size to your face to make sure with the double risk factor that you have if you're out in public or you're out during the holidays, that you're not bringing air in. Now, remember, by having the mask, everyone, around your face and having it be tight, none of these, you see all this stuff on TV where people's masks are falling off their nose, got to be over the nose, got to be tight around the side so the airflow can't get out. We now know, and we've learned a lot from this pandemic. We suspected, but we now have data that we know that protects not only you from COVID-19, but also protects people that are around you from COVID-19. So it's really important. Try not to touch your face. Try not to touch the front of your mask. These are the key elements that you need to watch out for. Now, the Centers for Disease Control has let us know that we are not recommending that you use masks with these one-way valves. Have you all seen these masks? They have these valves on them. The reason for that is that what happens with those masks is they may not protect you as well, but you're blowing a whole bunch out through that one airway valve, and you may put other people at risk that are around you. So the masks with the one-way valves, people have them for painters. Some people have them because it's easier to breathe out of them. Those are not good. You're actually better off with just a regular, what I call the old-fashioned blue surgical mask that, you just pull it around, make sure it's, it's taut and tight. Here's one of those masks here. And so it goes around here. And notice that here on both sides, it's tight. Around here, it's comfortable. I can pinch it around my nose here. It goes around my chin here. Keep my hands off of the face of the mask, and that's it. And, it's not one of these cloth masks that falls down. If you have a cloth mask, it needs to be able to do this. If you do this, you don't need an N95 mask, okay? And we want to save the N95 masks. The CDC has told us, especially now that we're peaking again, we want to save those N95 masks, okay, for the folks that need them, the healthcare workers that need them. But Tracy, you've got double risk factors here. So if you do get an N95, don't bother getting one. It's not worth your money unless you can go to a hospital or a clinic where they can do real N95 testing and they can see how much it's actually blocking the air getting out. So Tracy, thanks for your question. Diabetes and Parkinson, type 1 young onset diabetes and Parkinson. God bless you. And we're just sending all our positive thoughts for you, and so it's super important. A reply to Hannah, please look up in our chat here. Our great staff at the Parkinson's Foundation that keeps me honest has a nice link here for you, understanding COVID-19, about the recommendation to everybody should get a flu shot with this. It's super, super important. So let's talk about, we got some questions that came in, several of them, and I'm going to condense those together because I think these are important questions. Everybody wants to know about the vaccine, okay? Let's talk about the vaccine a little bit. Am I excited about the vaccine? Well, you bet I'm excited about the vaccine. One of the things that excited me the most about the announcement from the Pfizer vaccine, and then we're going to see some data from the Moderna vaccine. I haven't seen the data yet, and obviously we want to see the data, but if it truly is 95% effective at preventing, the onset or acquiring COVID-19, that is way higher, way higher than we thought it was going to be. We were hoping for 60, 70, 80%. And so I'm pretty excited about that. I'd like to see what the safety implications are, the storage of it, how we're going to get it out. You're going to need multiple doses and all those things the same. Now, that's more of a traditional vaccine that stimulates your immune system. And then there's another vaccine coming out from a company called Moderna. And Moderna got its information from the vaccine actually very early on. In December, January, in China, they released the sequence of the virus of COVID-19 very early. People don't talk about that. And it actually went to the National Institutes of Health, and colleagues in the laboratory of Anthony Fauci and that group at NIH very quietly sequenced it, okay, got its DNA structure, gave it to companies like Moderna, and they have what's called an mRNA. That's RNA is the thing that makes proteins from DNA. DNA is the genetic material. And they have an mRNA where they can do a lot of cool new scientific things in a vaccine construct to try to address the virus. And so there's a couple of different types of vaccines. We don't know which one's going to be best. And we're looking to see the data. We want to see the safety, and we want to see how good it is. But a vaccine that's good, hopefully we'll be able to get that and to get it out. But still, with or without a vaccine, listen to what I'm going to tell you here. With or without a vaccine, the number one thing you can do is mask. If we all mask, talk about not needing lockdowns and close downs and all these things. Mask is the number one thing we've learned from this. We've been talking about this over and over in our coronavirus Facebook Lives at Parkinson Foundation. We've suspected this, and each time I come to you live, there's more and more data supporting this notion. It protects you and it protects the other person. And it used to be, well, they thought it was only one way. It's actually two ways. So if we mask, okay, and getting back to this question, do I have to wait to a vaccine to travel? No, not necessarily. If we all mask, and when you get on a plane, it's a closed environment, okay? So this question comes in, there's a closed environment on that plane, okay? So a lot of people will also wear eye protection, okay, along with that. So they'll wear something over their eyes, something better than the glasses that I have on here that come around the outside of the eyes. A lot of healthcare workers do that. There is a recommendation from the CDC on healthcare workers for that. But in that closed environment, distancing as much as you can. So if they're not packing the airplanes, and then masking. Some people will double mask. Some people will use a fitted N95 mask when they're traveling. And so I don't think that it's going to be just based on the vaccine that's gonna start to get travel, particularly air travel, going again. I think it's gonna be our discipline of mask. And if you look at a lot of the countries in the Eastern Hemisphere, they've done really well. And what are they doing really well? Mask. What's the culture when people get sick in the countries in the East? The culture is mask. Okay, you see people, I don't know, I visited China, I visited Hong Kong, Korea, multiple countries that are in Asia. And you see when people get sick, they wear masks. That's part of the culture. Well, guess what? At least those of you who are listening to us from America and from Central America and other regions, we need to join that culture if your country doesn't have that culture, because that turns out to be, super important. So do you have to wait for a vaccine to travel again? Probably not. The numbers right now are so high. I don't know that air travel is such an awesome idea with things spiking. But as we begin to draw those numbers down, mask is important. Mask plus vaccine is going to be, a great thing. So thanks for that question on vaccines. I'm going to follow up with a second question on vaccines, and that's, should someone with Parkinson's disease get in line when the new vaccine becomes available, or wait to see how it's going to affect people in general? Awesome question. Awesome question. Should I have Parkinson's? Should I get in line for the vaccine? Okay. Here's the bottom line. Okay. We need to see that safety data as it comes out. It's going to be made publicly available. A lot of the top scientists in the world have been, maligned a bit during the crisis, but these are still the top scientists in the world. So you take all politics aside, we're all going to take a look at the data. Okay, those of us who are infectious disease experts, those of us that are not infectious disease experts, we want to see the safety. But the other thing that we want to see about that data, and it comes from this question, is we want to see how did different age groups do with it in terms of safety. Were there more adverse events in certain age groups? How did people with other chronic diseases like Parkinson or diabetes we've talked about here, how did they do with the vaccine? How did they tolerate it? So we want to see some of the sub-analyses as well. So it might be that the entire average for everyone was at 95%, but there might be subtle differences or not so subtle differences, and there might be something in the side effect profile in certain age groups. The other thing is that sometimes during the testing, we do our best to get as many diverse cultures enrolled in these studies. And the great news here is that there's just literally thousands and thousands of people have stepped up to take these vaccines, which is very courageous. But we're still going to be what we call underpowered without a lot of data in certain ethnic groups and in certain diseases. So let's take a look. My guess is that if folks like me that might represent Parkinson's disease, folks like Dr. Fauci and others that represent infectious disease, who are infectious disease experts, if we say we're going to take it, I'd follow the lead. So when I go into a room with an individual person with Parkinson or with a family member with a movement disorder, if I say, look, I'm not political, look at me. If I'm wearing the mask, I want you to wear the mask, okay? Let's not talk. You vote for whoever you want. Let the politics be with the politics. If I'm taking the flu shot, you should probably think about that. So if I'm taking it, if your physicians and your healthcare workers are going to take it, then you should probably follow. That's a good rule to follow. But let's wait for the data to see in the age group, okay, and to see what sort of data we have about adverse events and positive effects in different age groups. But my sense is that we should probably get in line quickly if it is as good as it seems to be. But I'm a scientist. I like to see the data. I run a lab, and I just don't make decisions without seeing the data. So beyond the news, let's let some people that we trust have a look at the data, and we'll let you know. So yeah, get online, but watch what your healthcare professionals are doing, follow their lead, and ask, was my group represented well, and is it going to be safe to take the vaccine in my individual group? So thank you for that question. So Cindy Armoscus, thank you for the question. Cindy wants to know about staying hydrated and how to get your PD spouse to drink enough water. Cindy, this is so important, and this is one of those things where I just see it over and over, even in really intelligent folks who have Parkinson, who know how it works, that there is this difficulty in getting enough water, and if you don't get enough water into your system, if you don't get hydrated, particularly in the sun, if you're out doing things, you can get dehydrated easily. You get dizzy when you stand up, and you can pass out with Parkinson, and this can be super, super dangerous. And so I always say the water bottle trick. Many of you know I talk about the water bottle trick. We have a blog on parkinsonsecrets.com, and we have a tip of the day for Parkinson disease, and one of the tips of the day is the water bottle trick, and that is every time you take a dose of carbidopa, levodopa, or Matapar, or Cinemet, or Ritari, or whatever your dopaminergic formulation is, what happens after you take that is your blood pressure actually goes down, and that's what's causing the passing out, is the blood pressure going down, and the progression of the Parkinson causes your blood pressure to go down. And so sometimes you need to come off of blood pressure medicines. One of the silver linings of Parkinson, oftentimes you can get off of blood pressure medicines, but because that effect peaks about an hour after you take dopamine replacement, if you take a bottle of water, a regular, 12-ounce bottle of water, and you knock it down each time you take your Parkinson medications, you're going to be less likely to pass out because you're going to be hydrated by the time it peaks in your blood system about an hour, hour and a half later. So if you do that, that can help you. And then if you're continuing to pass out or continuing to not be able to get enough water in, then you might have to use compression stockings over the legs and abdominal binder, or even some medicines like Florinef or fludrocortisone or midodrine or some of the other newer medicines like Northera to address this. And so this is a super important thing, and we don't want people to pass out. And when you're off your game, we're seeing a lot of passing out here during the pandemic. People are at home, they're not exercising as much, they're not in their regular habits for eating food, and so it can be a really, really tricky area. So, speaking of staying hydrated, Cindy, I have another couple of questions here about COVID-19 and the holidays, about foods that I would like to address. And so the first is, can the virus spread through food? Awesome question. When we first started, we didn't know a lot about COVID-19, and you saw many people, myself included, talking about wiping down surfaces, talking about ordering our food from outside. When we get those orders, switching the containers, wiping things down, and making sure that we're not spreading things through actual food. It turns out that as we've been following this, the CDC has been interested in this question, as well as other healthcare agencies around the world. We're not seeing a lot of evidence, any hard evidence. Excuse me, we're not seeing evidence that, picking up a letter from your mailbox or picking up some of the packages from your food is a way that we're seeing spread of the virus. Is it possible? Certainly we believe it's possible, but quite rare. I would continue to wipe things down, but I don't think actual food that you accept, and there's a question here about accepting baked goods from others, probably pretty safe, actually. Watch for the outside containers. You can always get rid of those and wash your hands, but pretty safe. And you can eat food safely that someone else has cooked during the holidays. And so this is super important. And remember, we're talking about, the pandemic and COVID-19 and preparing ourselves for the holiday season. That's our general topic here today, and so I'm going to come back and be redundant again. And remember Dr. Okun's 3 C's on this one. C for cover your face, 2 to 3 plies, no gaiters, no bandanas. The second C, control your environment, go outside during the holidays, keep your events outside. Third C, contain your people to 10 or less, and contain your eating arrangements, spread out. When the mask comes off, eat it up quickly, put your masks back on, but stay spread out and stay outside while you're eating. This is the best way to be able to contain the virus, and so super important during this area. So Aaron says, thank you for the explanation regarding safety and hospital appointments. You are very welcome, Aaron. We appreciate it. Helena from Central New York, welcome, Helena. Is very stressed, getting immune IVs every 3 weeks, has a couple of different things like Lyme and immune deficiency and an immune deficiency syndrome. Helena, if you have immune deficiency, this may be, one of those areas where it may just be better for you to mask and stay at home away from any gatherings, and wait this pandemic out, because you may be at very high risk. I don't know specifically which immune deficiency you have, but you may want to talk with your docs. And if you have Parkinson's plus a true immune deficiency, then that's an area where you may want to sit out some of the holiday events or keep it very, very small. So Nikita Krielart from the Netherlands says the Living with Parkinson is an amazing book with a few emojis. So thank you, Nikita. Tracy wants to know how you purchase it. It's just on Amazon.com. We send proceeds to charity, to Parkinson charities. Also, our other book is Ending Parkinson. I can show you that one too. This is also out here with Ray Dorsey, Boss Bloom, and Todd Scherer. Proceeds also to charity as well. Leave us reviews on this book and this book on Amazon, and we'll spread the word and put the money back into into Parkinson disease, but should be pretty easy. And again, congratulations to Sherry for winning the autographed copy of the book. That was great. And if any of you, if I don't get to your questions, feel free to write to Kathy Whitlock at the Parkinson's Foundation or call our 1-800 4PD info helpline with our nurses. We want to make sure we answer your questions. And every time we get on one of these Facebook Lives, it's just so great because we want to get information out, and when you ask a question, it helps somebody else who's also asking a question. So Diane Russell says the book's great, so much information. I love the way the information's arranged. The format makes it easier to find what you're looking for, not textbooky. That's why we partnered, Diane, thank you, with the Robert Rose Company, who has written a lot of your famous cookbooks that are in your kitchen, because we realize that people like me, we talk in this different language, this foreign medical language, and we don't make things in charts and tables and anecdotes, and we make things too hard for folks with diseases. You haven't been to medical school, you haven't been to occupational therapy, speech therapy, or pharmacy school. So I think the Robert Rose Company did a wonderful job putting that together to try to make it easier. So Karen Palmquist asks, I'm having what feels like contractions in my bladder when I lay down. I'm wondering if that is my Parkinson disease. So Karen, thank you for that question. There are multiple symptoms that can happen in Parkinson. One of the ones that we've written about quite a bit are bladder issues. And I think it's an underappreciated and a really one of those symptoms that can have such an impact on your quality of life. And a lot of folks will tell us when they lay down or when they go to sleep, their bladder sort of acts up and they've got to get up and go to the bathroom a lot during the night. And this is related to Parkinson in most cases. Now, you obviously want to check for urinary tract infections and kidney infections, which can worsen all Parkinson symptoms and can lead to something called sepsis, where the infection gets into your bloodstream and you can die from that. So I don't want to tell you that all of these problems are due just to Parkinson. Sometimes there can be a small tumor in the bladder or other things. And so it's important to have a urologist look at you. But in the majority of cases that I see, I work with a great neurologist named Lou Moy, and in the majority of cases we see together, it turns out that it is the Parkinson. Lou doesn't find anything wrong with the bladder, and I have another OBGYN who is specialized in bladder as well. And when Emily Weber-LeBron and I look at cases in women, so women like the symptoms that you have, what happens is that the bladder features persist and we don't find another cause, and we do believe that it's the Parkinson. And so there are exercises that you can do. There are sometimes certain medicines, but you got to be careful with the medicines because they can have side effects with what are called anticholinergic side effects. They block a chemical in the brain called acetylcholine, can cause you to be confused. And so we have to be really careful with those. But some of these rehabilitation and other methods, and occasionally we can do surgeries or things depending on what you've got going on. And this is an area where we really need to grow. And so I'm really hoping we're going to see more and more studies in this area. So Karen, the answer to your question is I'm wondering if it's my PD. If you were going to bet your friends, and it's been going on for a while, probably is. Check it out with the urologist. Head back to your neurologist if the urologist doesn't find anything, and start to work your way through. Look on our Parkinson Foundation website and also our helpline, 1-800-4PD-INFO, and some of our nurses can talk you through some of the things we think about. We also, I want to mention, have a study out now called PD Generation. And it's a cool name because it's generation, like the Parkinson disease gene. And remember, what's really cool about this study that the Parkinson Foundation is doing is we do believe that the future is going to be in precision medicine. So 10 or 15% of folks with Parkinson are going to have genetics that are easily identifiable by blood tests. So that means 80% of you won't, who are listening and have Parkinson. But for that 15 or 20%, we may be offering some precision medicine for treatment. And so the Parkinson Foundation has this great study called PD generation, and it really is one of the things you can do is have your gene status checked. So as these studies open up, and there are some for 2 of the genes now that are open, there are studies for a gene called LRRK2, or the LRRK2 kinase gene, and one for the what's called the GBA gene, and those are the 2 common ones. And so looking at that is super important. So Cindy Oakley Johnson writes, stress is terrible for my Parkinson. Cindy, you're not alone. Join the club. Stress, anxiety, all worsen Parkinson's symptoms. Our great staff here, if you look in the comments right under yours, is following along here. They've given you a link at parkinson.org for stress management and things that you can do to reduce your stress. And I'll tell you one cool thing. My daughter, 11-year-old daughter, has an Oculus, and my wife showed me they can program it. They have these different stress things, so you put on and you get a 3-dimensional world, and you can choose 20 or 30 or 60 minutes of stress management and meditation and learning how to breathe. And so, these things can be really, really, really helpful. And depression, anxiety, demoralization, all of these are higher in Parkinson. And so we do need to learn to deal with the stress. And by the way, for those of you who are caregivers or care partners, more than half of caregivers and care partners in Parkinson, okay, more than half have caregiver strain and stress. And we've got to identify that. And at least 1 in 5, maybe 1 in 5, 1 in 6 persons with Parkinson don't have depression or anxiety. They're just demoralized. We need to do a better job identifying these folks, and there's actually quite a bit written in this book on living with Parkinson about demoralization, which I think is one of those areas that is the most forgotten areas for treatment of Parkinson, and so I think that's really important. So Joe Zima writes in about my smell and taste are already greatly diminished from my Parkinson. Remember, these are prodromal early symptoms in a lot of cases of Parkinson. So how can COVID be detected in my case? Well, as you know, this very mysterious thing happens with people who are diagnosed with COVID, in that they can lose their smell and then get it back. And we do not understand this, but there have literally already been dozens and dozens of papers published in major medical journals about this anosmia, or loss of smell. It turns out that is not the only thing that we see, and we don't see it in all cases. And so if you're suspecting COVID-19, you can simply get a test. The best tests that you can get are called PCR, polymerase chain reaction. There's a lot of different tests, but the PCR is the best test that you can get for the money, okay? And you can check to see if you have COVID, because there can be all sorts of symptoms. And in fact, 1 in 5 or more people could be asymptomatic, okay, for the COVID infection. And so even though your smell and taste are diminished, hard to know. Now, one of the questions that people have brought up is, because COVID is attacking smell, and smell is one of the early symptoms of Parkinson, could this be like certain strains of the flu that put you at risk for getting Parkinson later, for those of you that don't have Parkinson? For those of you that do have Parkinson, guess what? Relax. You don't have to worry about that. For those of you that don't, there's a question whether COVID infection will increase your risk of getting Parkinson later on in life, like we've seen in other types of viruses and influenzas with Parkinsonism. We don't know. We're seeing some interesting cases, but it's going to take years and years to unravel that. And so that's super, super important. So I want to draw your attention, again, as we're closing down our hour here, to our 1-800-4PD-INFO. Pick up the phone, dial 1-800-4PD-INFO. Our awesome best-in-class nurses will answer your questions. If you need an Aware and Care kit, you can get it by going to parkinson.org/aware and care. If you need, and that's for hospitalization, the Aware and Care kit. We've given out 100,000 of them. These things can save your life. It's based on a dozen different research papers that the Parkinson Foundation has put out. We have a PD Health series that's online at parkinson.org. PD Health, Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. And stay up to date on COVID-19 on parkinson.org/coronavirus, all one word. And so I will end by saying this has been a great hour. I'm sorry we didn't get to all your questions. Please call our helpline or send your questions into PF, and we'll make sure either myself or someone else can help you to get answers. We are here to help you through this. All of our series have been archived. We've had as many as, almost 100,000 views on a lot of these coronavirus videos and Facebook Lives that we've had out. Hopefully this has given you some tips. And I will end with the 3 C's. Remember Dr. Okun's 3 C's, okay, for enjoying the holidays. The 3 C's: cover, control, contain. Cover your face, control your environment outside, stay outside, don't congregate inside, contain people to 10 or less, contain your eating arrangements. Cover, control, contain, no gator masks, no bandanas at all. These are a big no-no, and no one-way valves on those masks. I want to congratulate Sherry. We're going to be sending you, make sure you send your information to Kathy Whitlock. We'll send you an autographed copy of the book from the Robert Rose publishers, from the cookbook publishers, with all of our tips on treating Parkinson's disease. And we have reached the 1 o'clock hour. We are going to put this online so folks can look at it who may not have been able to attend live. And if you have suggestions for future events, please let the Parkinson Foundation know. They are just an awesome organization that are really committed to helping people. And so we feel for you. We want you to have a great life. Hang in there. We're going to get through this pandemic. The vaccines are coming. But remember, the number one thing you can do is mask. Okay, look around you. If everybody's masked and distanced, mask. That's what's going to get us out of things, not the vaccine. So be careful. Have a great holiday season. And it has been, just awesome to be with you for an hour. Thanks.